I bet you guys have all heard that China recently further relaxed its COVID restrictions. PCR tests are no longer required when entering most public venues. But before we dive into that, let's first take a look at this set of numbers. China, the world's most populous country, has seen about 5,200 deaths over the past 3 years. So 1 in every 269,000 people died. The United States, over 1 million deaths. Japan, over 51,000. And in tiny Singapore, over 1,700 deaths. That's 1 in every 2,900 people. Some say China's measures are harsh. A lot of people have barely traveled anywhere over the past 3 years. And same for me too. But keep in mind, we're talking about a mega country of 1.4 billion people, with the vast majority coming from relatively rural and less developed regions. The country is learning along the way to strive for, and let me quote here, a more science-based and targeted mechanism. Adjustments to the quarantine scale were made over time. To be exact, the country issued 9 versions of its epidemic prevention and control plans. At first, mass testing was required. People in most cities needed to do a PCR test every 3 days to make sure their household stayed clean. And as of now, tests are no longer required when entering most public places, except for nursing homes, hospitals, and schools, places where the most vulnerable people are found. Also at first, confirmed cases were sent to all those makeshift hospitals. But right now, asymptomatic and mild COVID-19 cases are allowed to quarantine at home. When the virus was still aggressive, China acted aggressively. And with the Omicron now being milder, China is easing its policy. At this point, Chinese officials are stepping up medical care to prepare for a potential increase in patients. They're also urging a continuous push for vaccinations to make sure that the seniors and the youngest ones stay protected after the restriction relaxation.